Okay, so today I'm going to talk about how to change an ostomy appliance, and also how to measure which for a budded stoma, one that's sticking up, or a flush stoma, and how to place that appliance properly. I like to gather all of my supplies. I like to have extra towels handy. I usually drape a towel on the patient's abdomen in case there's some drips. I get some more washcloths because we're going to use a wet washcloth with just water. Warm water is helpful. We don't use those bath wipes or baby wipes or soap to cleanse the skin around the stomas. We just use a wet washcloth, and that's because the baby wipes or soap typically have moisturizers or oils in them, and that will leave a residue on the skin, and your new appliance will not stick. So it might stick for 5 minutes, maybe 10 minutes, but sometime it will come off, and yeah, it's very frustrating for the patient and for you, I'm sure. So today I have an appliance that's on a stoma, so we're going to take this off, and we use our lovely, we love this is adhesive remover. Again, rip this open, and I'm going to pour this on the edges of my tape here to help that saturate into the edge. I usually start at the top, and I'm going to start at the top and take this off towards the bottom, because if there's any output, it will still be captured in this bag. So I'll take my little wipe, and I'll start to, as this is lifting, I'll just work underneath it and take this off. And as I'm pulling this off, I'm also supporting the skin as I pull. So I'm not taking the skin with me. So I'm supporting that skin as I'm taking this off, okay? Now that I have this off, I take up my wet washcloth, and I'm going to wash off any residue. Now let's say there's an extra waxy ring or some debris on here that this is not going to take off. I will take another one of these and work that sticky debris off, and it works really well. Now if I do use this on the skin, I do want to follow with my wet washcloth and wipe off any of this chemical off, because it possibly could prevent the next appliance from adhering. So I'm washing that off, and I dry, make sure it's all nice and dry. And the next step is to measure the stoma. So inside your kit is a measuring guide. So it's inside of all of this information. There's a little measuring guide. And all of these are circles. They're not oval, and we have an oval stoma. So we do need to cut out a hole that is oval, not round. So for instance, this particular one doesn't fit real well because it's circular. And if you make it too large, you expose all the skin to the stool, or it could be stool from the colon or stool from the small intestine, which actually is more caustic to the skin. So we definitely want a very close fit, but just a tiny bit, I say a sliver or a smidge of room. We'll say, in technical terms, we'll say anywhere from 1/16 to 1/8 of an inch. But if you don't have those oval measuring guides, which sometimes we do, there's another way of measuring. So I'm going to measure the length of this stoma, and I'm going to see one that's too big. So this one, yeah, it's just a smidge larger than a 1 3/4. So what I'm going to do, I'm going to take my wafer, yeah, and for the length, I'm just going to make some marks. This is my 1 3/4 length. Width-wise, a little bit smaller than that, so I'm just going to look at this part now. So we're about, if I hover over it, we're about 1 1/2. And again, I'm trying to make sure I get a little bit of room around that stoma. So we'll start there, 1 1/2. So I lay this down on my wafer, and now I'm going to go width-wise. So I've got my marks, length and width, and now I just connect those lines together. That gives me more of an oval that I'm searching for. And even if this particular oval that I've drawn is too small, I can certainly open it up. This is just my beginning oval. So I'm going to take my scissors, and if you use the deep part of the scissors, it will give you a smoother cut. So I go into the starter hole, I come out to my line, and I want to typically cut the line off. And so I just follow this around, and see how I'm not cutting with the tips, I'm cutting with the deep part of the V. Okay, I'm going to cut just a little smidge bigger because I know the stoma's a little bit bigger. Okay, and I check to make sure I don't have a lot of jagged edges because I don't want to cut the stoma. The stoma can bleed easily, so we want to give that little bit of space. Okay, so I can see that's too tight, so I'm going to go back, give the stoma a little bit more room. And we can cut just a tinge past that line if we need to. Otherwise, I would get the next size up. So this one happens to be what's called a 2 1/4 inch. That's the diameter of this ring. They have a 2 3/4 inch. They even have a 4 inch. So whatever you need. Let's see how we're doing here. Okay, so this is the other thing I wanted to mention. This particular stoma is more like a mushroom. So it's wider on top and narrower at the bottom. So even though it's a little tight here, if I get down here and I've got a smidge of room, that's what I want, because this actually helps cover up that skin at the bottom. Okay. So I'm going to say that's a pretty good fit. Next thing, I take this off. You can generally use this template the next time that you change it, but generally this will shrink every time you change the appliance, which is about twice a week. So you do want to remeasure. Okay, and then we do like to use a barrier ring. Now these are very, very handy. They won't harm the stoma if they touch it. They're very soft and pliable. You can warm it up a little bit in your hands. Take off these little pieces here, and once it's warm, it stretches really well. So I'll stretch it out to approximately the size that I need, and then I'll line this area right here like so. These white portions are for your fingers, so you're not always touching the sticky parts. And then I'll generally use this too, because it's less sticky than my gloves even, to make sure I don't have any gaps in that ring that I've just laid down. Okay, I'll check back to make sure no effluent has come out onto the skin. If it has, I will go ahead and clean that off and dry once again before I put my appliance on. I usually teach the client to dog ear these so that I have something to grab once I lay this down. Okay, so I'm going to go ahead and put this on. Now, because this is hard, it's not going to be squishy and move with me, so it's going to look like I'm forcing it, but that's because it's a plastic model. So I'm going to pretend that this just went on the skin. Then I pull these off, lay that down in the side, okay? And then we snap on our appliance, like so. Now, I know the nurses will put it off to the side, but once the patient is ambulatory, we like to have it straight up and down so that they can get on the toilet and empty it between their legs. So get around, snap this on. Okay. Now, the clamp. This clamp is curved, so it's ergonomically shaped for someone's leg or thigh or abdomen, wherever this is sitting. So generally, what I want to do is put it on with the curve down like this, so it fits along that curve nicely and does not, many times I'll see it up like this, which means it'll catch on clothing and it won't feel that comfortable to the patient. So it goes on like this. So we open up the clamp. One fold is necessary. We don't need to roll it up or accordion roll or fold, just one fold over the top, and then we close. Okay, and that's it. And I always do this to make sure it's on there. So that's the way it should look. To empty, we open this up, and what's nice to do, because we teach the patient this too, is to fold this back like a cuff. It'll make cleaning this much easier. So you have your urinal and you're emptying it, and stool might get on there. This is all exposed, very easy to clean. You can use your baby wipe or bath wipe on this part, no problem. Make sure that's good and clean so it doesn't smell or get on the client's skin or clothing. And then we straighten this out and put the clamp back on. Okay. Now, if the client is ambulatory and say they're about to go home and they want to take a shower, this entire thing is waterproof, so it's okay to get in the shower. You do not have to cover it with a shower drape or anything. Just out of the shower, you would just take a towel to dry it all off. Sometimes folks, if they have a hair dryer on low, they can use that to dry off this material because it's a little bit more like cloth, so it takes a bit longer to dry. So I wanted to talk about a stoma that is flush to the skin, because many of the patients who have a lot of girth in their abdomen, the surgeons can't always bring that intestine up to the surface enough so that it looks like a beautiful budded stoma. They can only get to the very surface, and stomas end up looking very flush to the surface, which is not ideal, but we have products to work around that. So before if there's a wounded area, before we treat the skin, generally I like to get my appliance all ready to go, because I never know when the stoma might have an output. So I will go ahead and measure my stoma, and let's say, oh, I went right to it. This is exactly, I don't know if you all can see this, just a hint of skin or gap between my circle and the stoma, and that's perfect fit. So we're going to say it's 1 3/8. We're going to go ahead and mark it out. So I'm going to trace this out. We got lucky. The stoma is a perfect circle. And I'm going to go in here and cut with the deep part of my scissors. And I don't know if you can see, I'm turning as I cut. So I have a teensy bit of room all the way around, and that's what I want, just a little bit of room, okay? Now, if by chance you made it a little bit too big, and I'm going to show you maybe a bit too big, like this, is a little big, but this is where this ring comes in really handy, because this can help hide that gap and protect the skin. So we always like to use a barrier ring with our appliances, especially 100% of the time practically we do it with an ileostomy, because that liquid stool will easily leak underneath our appliance. It's just too watery, so we like to put the barrier ring to create that seal on the back. So I'm going to go ahead and warm this up so it stretches easy, and I'm going to get it on my circle here that I've done. Okay. And put that on there. And I would prefer if folks didn't try to pull it back off and put it down, because it just won't work. Once it's on, if it's not in the right spot, just use your fingers or this to push it back into place. Okay. So now I've kind of, in this situation, I've kind of hidden some skin there. So you see a little bit of the ring exposed. That's just to hide the skin, because it might have been cut a little too big. So again, this ring will not harm the stoma. It's nice and soft. It's the other part of the ring that might harm the stoma, because it's more firm. So it might rub and possibly cause it to bleed. Typically, stool will have infiltrated or undermined that wafer, and let's say there's a little irritated skin. It could be open, it could look raw, it's typically red. So let's say we have an irritated area. What we're going to do is, again, we cleanse the skin with our wet washcloth, okay, of any debris. And I want to do what's called a crusting technique, and you might have heard us talk about this, but what the crusting technique is we use our stoma adhesive powder, and we just want, just like when we use miconazole powder, we want to just dust a very light amount onto the broken skin, or if we had a rash. So I'm going to demonstrate, and typically it works better if I go from the side than if I turn it upside down, because then a ton of it comes out. So I will come from the side and gently sprinkle some of this, and I'll usually rub it in because the moist areas will absorb that powder. Any excess that does not absorb the powder, I will brush it away because I don't need it. Okay, but the moist areas will, that powder will stick into the moist areas. Then I take my No Sting Cavalon. There's no alcohol in here, which is nice, so it won't burn. And I'll take this and I will blot directly over that powder and that wounded area with my Cavalon. So I just do this, I blot. I'm not going to wipe because I don't want to wipe that powder off. I just blot directly over it. The liquid comes out, saturates the area, and we let that dry. And again, 5 to 10 seconds. I usually help it along because we're all in a hurry. So once I can see that the shiny goes to matte, then I know it's dry, and I will do it again. So I will go and sprinkle just lightly, rub it in, excess. I don't want all those clumps there because it can affect adhesion of your appliance. And I will take my Cavalon and go back over that. Okay, and let it air dry. And we may ask you to do it 3 times, and that's usually the maximum. It's 3 times, so we'll do it one more time. Kind of rub it in, and then this. Okay, and air dry. Now, we've treated the skin, we have our appliance ready to go. Let me do this. And even if I'll put a towel or something after we've treated the skin so that if there's any effluent, it'll go on the towel as I'm doing something. Say I forgot to do something. That way it'll protect your skin. Okay, so everything's ready to go. I'll put my appliance on. And snap this on. Okay, and then we're done. We're done with this little guy here. Oh, one other thing I wanted to mention is that after I put this on, or any appliance on, I usually will rub a little bit around the stoma to get that seal to melt, kind of warm it up, melt and stick better. This is the most important part to seal around the stoma, around the edge of the stoma. This is just an adjunct, okay? This is just like a Band-Aid, not as important as this part. So we'll do a little bit of rubbing, and then if the client's hand is warm, we'll put that over the top for just say a minute to get everything to stick well. This is about our flush stomas. I had mentioned before that we have other products that we can use, and one of them is convex wafer. So this is dome shaped, and it helps fill in the gaps once it's on the skin, and it helps the stoma kind of protrude out a little bit better, so it's more of a spout. And we use this sometimes if we feel like it's going to help. So this guy here, we can, I'm not going to cut it out, but we can measure, cut it out, and then we do use one of these rings over the top still, even with this. Typically we do it because the stool is likely still more liquid, and then we'll put that down. And that's almost always we use this with a flush stoma like this. So I wanted everyone to be aware of this product. If you're having difficulty, especially say a week or 2 into it, the stoma has receded down to flush, this is kind of your go-to.